Hi everybody, my name is Chris Goodwin. I'm with Insurance Pros and I'm going to tell you a little bit about the 2018 group health insurance offerings from Doehring Management Group. And this year the company will be offering a Blue Cross Blue Shield of Kansas City plan, and it's available to all full-time employees with an average of 30 or more hours per week. Everybody has access to a copy of what I'm showing you here, and you'll see that these group plans are community rated, so there's no underwriting, and the rates are specific to your age. You also see that they're not gender rated, so someone who is a 30-year-old male, it's the same rate as a 30-year-old female, $348.90. But before I get too far into the actual rates, I want to talk about the health insurance plan that is available to you, and then I'll briefly talk about the dental plan that is available. As far as the health insurance plan, again, the company chose to offer one of the most cost-effective plans Blue Cross Blue Shield has, which is called the First PCB Silver Value 5000 plan. So I'm going to use this as a really quick example. Disregard that premium number here because that's just based on a specific demographic for a family that we had to quote in here. But this plan is a $5,000 deductible plan. So any individual on the plan for hospitalizations, surgeries, lab work that's billed outside of a doctor's office, subject to a $5,000 deductible. Now, you'll see here there's a family deductible as well, which is 2 times the individual deductible. One thing many people get confused by is they think that they have to keep on going until they've met 10,000 if they're on the policy with some children or their spouse. That's not the case. Each person in the family has their own $5,000 deductible, and Blue Cross Blue Shield does not allow you to assume more than 2 times the individual deductible between all covered family members. So that's just a stop loss for you. So now with this plan, after you've met the $5,000 deductible, Blue Cross Blue Shield is going to pay 80% of all covered expenses. That means that you're responsible for 20% of all covered expenses. So if you had $1,000 in expenses after you've already met your deductible, you're going to pay $200, and Blue Cross is going to pay $200 as long as you remain in network. Now, we may hit upon this later, but it's pretty easy to stay in network with this plan when you're using the Preferred Care Blue network. So you always want to check with your provider and make sure that they accept that plan and they're in the network. Most providers are, unless they're a concierge doctor or just a bunch of odd circumstances otherwise. Getting back to the 80% coinsurance, if you met the deductible, you're paying 80%. Blue Cross Blue Shield's paying 80%. You're paying 20%. Only up to the point where you might reach an additional $2,000. So this $7,000 is the maximum out of pocket to you should you be using in-network providers for covered services. So that should be the worst case scenario. So depending on where you're at, I mean, it's a good thing to have is $7,000 of total exposure. As you can see, the family out-of-pocket maximum is 2 times the individual deductible, or out-of-pocket, and that only applies should you guys have a pretty bad year. I want to talk to you now about first dollar benefits. These are benefits that you will get without having to fulfill your deductible. And the first of these first dollar benefits that I want to talk about is going to be the office visit copayments. So very important sorry, I was going to try to use a different color, but very important. When you're going in for wellness related items, you don't even have to fulfill uh, your copayment. So if it's on the routine wellness list, like an annual well woman examination, pap smears, mammograms, flu shots, um, blood work relative to a checkup, pediatric wellness visits, those things are all covered at no co-payment, no out-of-pocket cost when you're using an in-network provider. Now, if you're going to the doctor because you're going in for an injury or illness or a condition that you are being treated for, then you have co-payments with this plan. In this case, your first 4 office visits that are not wellness related are going to cost you $10. The good news on this is that that applies to general practitioners and family doctors, also internal medicine doctors and pediatricians, and then it even works with specialists. So if you're going to an OBGYN or a cardiovascular specialist, the $10 copayment applies, and it can be used as one of your 4 office visits. Now, urgent care is another one that can even be used as one of your 10 office visits. So that should clear up some questions I'm certain that many people would probably have already. One of the biggest questions that people have is, well, what happens after I've had my 4th office visit? If you had your 4th office visit and you're going to have a 5th office visit, it's still a covered expense. You're just going to pay the allowable charges for that doctor's office visit. So let's just say you're going into the doctor and you have met your 4th office visit and you don't have co-payment benefits any longer. And that doctor charges $130. Well, per their contract with Blue Cross Blue Shield, let's just say, for example, the allowable charge is $64. You would pay the allowable charge of $64. The rest gets written off, and that's the cost of your office visit. Usually you pay that after you've already, weeks after you've gone to that doctor's office. So, very important, 5th visit and beyond are covered. And they would be paid by you based on the allowable charges, and whatever you pay goes towards meeting your deductible. If you've met your deductible, then you're actually paying 20% of the allowable charges, because Blue Cross Blue Shield is picking up 80%. And of course, if you reach your out-of-pocket maximum, you're paying nothing out of pocket so long as you're in network and it's a covered visit. Final thing I'll mention on office visit co-payments is that if you're on the policy with a family member or more than one family member, then each of you have 4 $10 office visits. You don't pool the office visits as a family, and you're not limited to 4 as a family. We get that question a lot. So, you would have 4 visits. Your daughter or son would have 4 visits. Your husband or wife would have 4 visits. And once you've met your 4, then it goes to deductible. So that is an exhaustive explanation. My apologies to anyone who didn't need to hear all of that. I want to talk to you about another first dollar benefit, which is your prescription drug coverage. Prescription drugs are subject to your co-payments, and you don't have to fulfill your deductible. So, generic drugs are $10 or the cost of the drug, whichever is less. Preferred brand name drugs are $55 or the cost of the drug, whichever is less. Non-preferred brand name drugs or tier 3 drugs, 20% of the cost of the drug. So a lot of times if you are unsure, you always want to contact Blue Cross Blue Shield ahead of time or use one of the many resources that they have online. Now, there's a specialty tier or tier 4 category. These are highly restricted drugs typically, and those drugs are subject to your deductible, and then you pay 30%. So, if that drug costs $290, you pay out $290, and it applies towards your deductible. If you've met your deductible, you're paying 30%, not 20% because of the specialty tier of that drug. The good news on any co-payments is that you actually they actually apply towards your out-of-pocket maximum. So while they don't contribute towards your deductible, they'll contribute on the back end to your out-of-pocket maximum. They'll help you reach your $7,000. If you reach $7,000, you're not paying co-payments for prescription drugs or office visits. I will not spend a bunch of time on this in the interest of everyone who doesn't need to know this, and we can always make ourselves available. Out of network, you actually I'm going to put this in red. Out of network, and this doesn't matter too much, so I'm wasting our time. My apologies. If you're going to an out-of-network provider, Blue Cross Blue Shield is going to be on a 60-40 basis with you instead of a 80-20 basis. So they're paying 60 and you're paying 40, and you have a higher out-of-pocket maximum. So you'd have a $14,000 out-of-pocket maximum instead of a $7,000 out-of-pocket maximum. I think that the point to this is probably try to avoid being out of network. You've got a huge network with Preferred Care Blue. So I think that'll be highly of interest to anybody who's using this plan. The other things let me just touch on your inpatient, everything subject to deductible, and then your 80%. Their 80% is what they're going to pay until you met your out-of-pocket maximum. Same thing with outpatient as well, deductible and coinsurance in or out of network. Let's disregard all of these other plans because those are plans that are not available based on your plan. And I am not going to go through this because the abbreviated version that I provided you with pretty much explains the plan, but this is a really good piece for you to have with you if you do elect the coverage because it goes into a little bit deeper detail. And once you are enrolled, you'll get a contract that's available to you online that gives you more information than most people would ever want to know about these plans, but it gets into some significant detail about the plan, things that I didn't talk about, like, well, generic contraceptives, there's no co-payment for them per the Affordable Care Act. There are other different things. So dive into this. Everybody has access to it. I'll really briefly talk about the dental plan. The dental plan actually has is a standard traditional PPO dental plan. It's called the Blue Dental Plus 1000. Blue Cross Blue Shield pays 100% on the cleanings and x-rays. So here are all your diagnostic and preventive services. So if you're having these and you're using an in-network provider, then they're going to pay 100%. Basic restorative services such as fillings, tooth extractions, root canals, which most plans put that in a major services category, so this is actually a good thing that root canals, they're paying 80% on those services when you're using in-network providers. Now, basic services and major services are subject to the $50 calendar year deductible, and they limit a family to only having to have 3 deductibles if there was a lot of basic services within that family. But basic restorative services are covered at 80%. Major restorative services like crowns, bridges, partials, dentures covered at 50%. This plan does not actually cover orthodontics. So sorry to anybody who wanted to have that service. Let's see. Coverage. Definitely, there's a rewards program. It looks like if you spend between $100 and $300 using in-network providers, you're going to get $250 added onto your calendar year maximum. That gives me a great opportunity to talk about the calendar year maximum. because you actually have, um, they're going to pay their 100% on cleanings and x-rays, 80% on basic, and 50% on major until and unless they've reached 1,000 that Blue Cross Blue Shield has paid out. If you actually just are having cleanings 1 year and just moving along, they're going to roll $250 onto your maximum for the following year. So that's a good thing, and they'll do that even the year following. They're gonna max out their cap. They're gonna cap their rewards total at 500. So at any given year, you can have like 1,500 out-of-pocket maximum. So pay close attention to that. Looks like they have a tier of dentists that require a higher reimbursement, therefore, on specific providers that will be explained here. You actually are going to have 100% on base cleanings and x-rays, 80 on base, 70 on basic, and 50% on major. Finally, non-participating providers. Be very cognizant of this. Non-participating providers, Blue Cross Blue Shield is only going to pay 80%, and they're basing that 80% on the in-network fee schedule, or their usual, what they call usual, customary, and reasonable charges. So there is, it might not be 80% of what a non-network dentist charges. It's 80% of what the fee schedule that Blue Cross Blue Shield keeps track of. So 80% on preventive, 60% on basic services, and 40% is what they pay on major restorative services, $1,000 out-of-pocket maximum. So you got a lot of disclosures on the medical plan. Here's the summary of benefits and coverage everyone can have access to. Just a governmental format that covers a lot of the bases. So you will have that available to you. So that's your plan, and everyone will have access to a writable PDF to do an application. And of course, if you have any questions whatsoever, anything that can't be answered by Doehring Management Group, then you can contact Insurance Pros at 913-491-5200. We look forward to being of assistance to you, and